Welcome to MontyTV. I'm Nakayo Yang, and this is Interviews with AWS Startups. Joining me today is Pranav Rajpurkar, co-founder of a2z Radiology AI. Pranav, thank you so much for joining us today.
Thank you so much for having me.
It's wonderful that you can be here, and you have a fascinating background. You're building an incredible generative AI startup in the healthcare life science space, and your co-founder is your father. Tell us a little bit about this journey and how you got to where you and your father are together today.
Sure. So my co-founder and I guess, met 29 years ago at this point. And we've wanted to do a startup together. One of the things that I did after my bachelor's degree is went to the PhD program in computer science at Stanford. And that's when I started working on AI for medicine. And it was always clear to me that this was a technologically very hard problem and something that through my PhD I understood the complexity for and how we go about solving it. I got recruited into Harvard to start as faculty. I was one of the youngest recruits. And then over the period of running a research lab, made more progress on the task of how do we build AI doctors. And at around late 2023 or so, it started to become clear to me what the blueprint for building AI that does everything a radiologist can, what that looks like. And it was clear that this would unlock big value in imaging AI, and decided that it should be pursued as a company. And my dad and I partnered to be able to make that happen. Horowitz of the Andreessen Horowitz pair that says, co-founder setups have an inventor and an entrepreneur. And so the way my dad and I have our roles in the company, I serve as the inventor and he serves as the entrepreneur.
How did you go from your lab of experimenting, doing research on AI doctors to choosing to go down the radiology route?
Well, I think partly the skill set is very applicable, which is we're still working on a very hard technological problem. And I think what research is very good at is it's very good at taking things from concept to prototype. And time and time again across different fields, my colleagues and I have done those sort of pushes. And then we write a paper and then we sort of leave it for the rest of the world to build on top of. And maybe it takes 5 years, maybe it takes 10, maybe it takes 15. But that's a very different sort of approach to things than starting a startup, where we're interested now in saying, we know that this is technically feasible, let's go build something that's production grade that we can show adds value directly to the end customer such that someone is willing to pay for this. And that goal of the startup, I think, has shared certain ideas with having a lab, but in some ways is also in service of a different goal. That's why doing this as a startup has been sort of rewarding so far in terms of being able to actually pursue something that makes it to market and has a big impact.
As you and your father work together to pursue towards this goal, to develop a product, a solution that has a profound impact in optimizing patient health outcomes, where do you see your journey together continuing on to? What is it like working with your dad day to day?
It's a lot of fun. I think startups are hard. And one of the things that I think is important for your team, your co-founders, is the ability to have trust. And with family, I think one of the big positives, one of the big de-risks is that the trust is already there. Now, I know many family situations in which this wouldn't work out as a duo, but in the case of my dad and I, we found the ability to be able to complement each other's roles and be able to add value where one person suggests, why don't we do things this way? And that ends up being a much better pathway. So I think it's worked out really well for us in terms of being able to mix my scientific talent with his entrepreneurship and operational talent together.
The partnership seems wonderful.
Yeah.
You know, from from father and son to partner and partner and building a business is a dream that I think a lot of people would love to have. So it's something very special. So kudos to you and your dad for being able to do this and grow this company together. As you think about the next big set of milestones for you and your father for A2Z Radiology AI, what is it that you're looking towards and forward to?
In October 2024, we came out of stealth with a version of our product prototype called A2Z1. And with A2Z1, we showed that we could detect conditions from abdomen pelvis CTs at a very high level of performance. That was product prototype number one. And it took the community by surprise because abdomen pelvis CTs are considered very hard. And we came out and we showed actually this is something that we can take a significant stab at. We're working now on our next value proposition unlock, where we say, here's a technology that really, really works. Look at the amount of work that we have done to show that this technology really works. And we believe that it's important to do all that work because we're trying to build something that is ultimately going to be in real clinical workflows and going to affect patient outcomes. So we need to do it right. And so getting it right is a very important part of what we do, and building this technology that's not just something incremental and something that's going to change things by a very small margin. It's about how we make the big differences in terms of outcomes, in terms of the workflow of radiologists that's really at the heart of what we're trying to accomplish over the next few months.
I love that. Solving and optimizing for the workflows of radiologists, making them much more efficient and optimizing for patient health outcomes. When you think about the Montgomery Summit, we've got about a day and a half left of content, meetings with investors, fellow founders like yourselves, enterprise executives. What are some of the things you're looking forward to for the rest of the conference?
One of the things that I've learned as a scientist is that there are parallel ideas and parallel problems that essentially inspire similar approaches. And often some of the best ideas come because they get migrated over from another field where they've been understood, tested, tried out, where the failures and the successes are clear. And sometimes it's about the random exposures that one makes to these ideas, the ways people have thought about these problems, that really inspire a particular approach within the kinds of problems we're facing right now. So I'm excited about those conversations. At the same time, I'm also excited about the ability to meet people who share the vision, who believe in what we're doing, who understand that this is a field which is going to have big impact, not just from a commercial standpoint, but from the ability to service patients well.
Thank you so much for sharing a little bit about your journey with us, and we hope you have a great rest of the conference.
Thank you. Thank you for having me.